What are the genetic factors we should consider for fertility or pregnancy?
Preconception, I think, I'm lucky I get to see a lot of patients preconception, and so I'm always a big believer in doing preconception carrier testing. We end up sometimes seeing patients after they've already had a child who is affected with, say, cystic fibrosis or muscular dystrophy, and then they come to us later to do now testing on the embryos to identify those diseases. I'm lucky to see them often before they're getting pregnant, and so I'm a big believer in getting them tested preconception so they can identify if they're at risk of those conditions. If they figure it out when they're pregnant, it's tricky because by the time they're able to get their partner tested and then, get to whatever 15 weeks and do a CVS, amniocentesis, it's very stressful for them. So we can do a lot of genetic tests on embryos, including chromosome testing for trisomies, like Down syndrome. We can do single gene mutations. We can do chromosome testing for translocations, and now they're starting to look at polygenic gene testing, which is not as accurate, not ready for prime time, but I think will become more common over the next few years, looking at things like heart disease risk, looking at other kinds of conditions like mental illness. So we're not ready to do that yet clinically, I think, although some practices are offering it, but I do see that becoming more and more common in the future.